7 common medications that are secretly destroying your brain and how to avoid them. Have you ever wondered if the medications you take daily could be impairing your memory without you realizing it? What if I told you that some of the most prescribed drugs in the world can increase your risk of dementia by up to 50%? Is it possible that the solution to your health problems today is creating a devastating brain problem for your future? The shocking truth is that many common medications may be silently compromising your brain health, while you can't even imagine the danger. Dementia already affects millions of people around the world, and according to estimates by the World Health Organization, this number could triple by 2050. What you'll discover in this text could be the difference between keeping your mind sharp or slowly losing your most precious memories. Let's get started. 1. The treacherous benzodiazepines. The hidden price of calm benzodiazepines, such as clonazepam, diazepam, and lorazepam, are some of the most commonly prescribed drugs worldwide. These black label medications are often prescribed to treat anxiety, insomnia, and other stress-related disorders. The problem is that long-term use of these drugs is associated with an alarming increase in the risk of developing dementia. Scientific studies show that chronic use of benzodiazepines can increase the risk of dementia by up to 50%. The scariest danger is that many people use these medications for decades without any withdrawal plan or proper follow-up. In addition to the risk of dementia, these medications can cause severe dependence, amnesia, slow reflexes, and persistent drowsiness. The elderly are particularly vulnerable to the negative effects of benzodiazepines due to the natural changes in metabolism with age. There are natural alternatives that can help control anxiety without the same risks, such as valerian, melissa, and passionfruit extracts. Magnesium supplementation can also be beneficial, especially for those who suffer from anxiety-related insomnia. Stress management techniques such as meditation, breathing exercises, and cognitive behavioral therapy offer lasting solutions. And if you really need help, there are options like medical cannabis that can be discussed with your doctor as alternatives. But always remember that any medication replacement should be done with proper medical supervision, never on your own. Have you ever stopped to think about how long it has been since you, or someone you love, has been taking this type of medication? What could this be causing? 2. Anticholinergics, the silent thief of your memories. Anticholinergic medications such as diphenhydramine, oxybutynin, and ipratropium are widely used to treat various conditions. These remedies are commonly prescribed for allergies, urinary problems, asthma, and several other everyday medical conditions. What few know is that these drugs can double the risk of dementia in the elderly, according to recent research. The mechanism is frighteningly simple. They block acetylcholine, a neurotransmitter crucial for cognitive functions. When we interfere with acetylcholine in the brain, we are essentially cutting off one of the key neural communication pathways responsible for memory. The reduction of this neurotransmitter causes mental confusion, lack of focus, and gradual deterioration of cognitive ability. Many people take anticholinergics with no idea of the impact they can have on long-term brain health. For allergic conditions, natural alternatives like lavender or chamomile can offer relief without the same risks. Propolis and honey are natural expectorants that can help with respiratory symptoms without compromising brain health. For those who use these medications for urinary incontinence, pelvic floor strengthening exercises can be very effective. Most worryingly, many of these drugs are available over the counter, leading many people to use them for years without supervision. Your brain deserves protection, and knowing these risks is the first step to making more informed decisions about your health. But are these the only drugs that threaten your brain health? Read on to find out more risks your doctor may never have mentioned. 3. Statins, when heart medicine affects the brain. Statins such as simvastatin, atorvastatin, and rosuvastatin are widely prescribed medications to control cholesterol. Millions of Americans take these drugs daily, believing they are only protecting their cardiovascular health. What many don't know is that statins can significantly reduce the levels of coenzyme Q10 in the body. Coenzyme Q10 is essential for energy production in cells, including the neurons in your brain. Coenzyme Q10 deficiency caused by statins can result in mental fog, frequent forgetfulness, and a constant feeling of discouragement and confusion. These symptoms are often mistaken for normal aging, or even the first signs of dementia. Many people never make the connection between these cognitive symptoms and the cholesterol medication they are taking. Natural alternatives to control cholesterol include a healthy lifestyle with a balanced diet and regular exercise. Supplementing with omega-3s, black garlic, artichokes, and coenzyme Q10 itself can help maintain healthy cholesterol levels. Regular aerobic exercise is particularly effective for improving the lipid profile without the side effects of statins. Consuming 1 or 2 Brazil nuts daily can also help control LDL cholesterol thanks to their high selenium content. The decision to use statins should always weigh the cardiovascular benefits against the possible risks to brain health. What if there was a way to protect your heart without sacrificing your brain? The answer may be closer than you think. 4. Tricyclic antidepressants, the mental fog that no one told you. Tricyclic antidepressants like amitriptyline and nortriptyline have been used for decades to treat depression and chronic pain. Although they are prescribed less today than in the past, many people still use these medications regularly. The problem is that these antidepressants can significantly impair memory and learning functions. Patients often report a feeling of dull mind and difficulty concentrating during treatment. Modern science questions whether depression is actually caused by a chemical imbalance or if it is primarily a lifestyle-related illness. Studies show that non-drug therapies such as psychotherapy and physical exercise can be as effective as antidepressants. Many antidepressants show only slightly better results than placebo in controlled clinical trials. A holistic approach to depression includes therapy, regular physical activity, a balanced diet, and finding a purpose in life. Mindfulness and meditation techniques have shown promising results in treating depression without cognitive side effects. Exposure to sunlight and contact with nature can also significantly improve depressive symptoms. Importantly, any changes in the treatment of depression should be made with proper medical supervision. Mental health and brain health are intrinsically connected, and optimal treatment should protect both. Do you know someone who could be suffering these effects without realizing the connection with the medications? The next group of remedies may surprise even more. 5. Corticosteroids, your hippocampus's secret enemy. Corticosteroids such as prednisone and dexamethasone are potent anti-inflammatory drugs used to treat a variety of conditions. These drugs save lives in cases of severe allergic reactions, asthma attacks, and autoimmune diseases. However, its prolonged use can cause atrophy of the hippocampus, the brain region most associated with the formation of memories. Research shows that chronic exposure to corticosteroids can lead to the death of neurons in the hippocampus. Damage to the hippocampus caused by corticosteroids can manifest as persistent insomnia, unexplained irritability, and progressive cognitive impairment. Many patients who use corticosteroids for long periods report mood swings and memory problems without making the connection. The effects of corticosteroids on the brain are of particular concern because they can persist even after stopping the drug. Natural alternatives with anti-inflammatory properties include turmeric combined with piperine for better absorption. The omega-3s found in cold water fish also have potent anti-inflammatory properties without the same risks. An anti-inflammatory diet, rich in fruits, vegetables, and healthy fats, may reduce the need for medication in some cases. Stress management is also crucial, as chronic stress increases inflammation in the body and brain. It's critical to work with your doctor to find the lowest effective dose possible if you need to use corticosteroids. What do you imagine it would be like to find out that the drug that should be helping you is secretly harming your brain? And that's not all. 6. Hypnotics, the peaceful sleep that can cost you lucidity. Hypnotic medications like zolpidem are often prescribed to people suffering from insomnia. These drugs promise restful sleep, but often deliver only artificial sedation with serious consequences. Studies show that hypnotics are associated with a higher risk of brain fog and falls, especially in the elderly. A fall for an elderly person can mean a femur fracture, emergency surgery, and in many cases, fatal complications. The mildly hallucinogenic effects of some hypnotics may persist through the next day, causing confusion and increasing the risk of accidents. In addition, these medications often do not provide the truly restful sleep that is essential for brain health. Many people report forgetfulness, irritability, and a drug hangover after regular use of hypnotics. Natural alternatives include sleep hygiene practices such as maintaining regular schedules and creating an environment conducive to sleep. Supplementing with melatonin can help regulate the sleep-wake cycle without the risks associated with hypnotics. Soothing teas like chamomile, lemon balm, and passion fruit can induce natural relaxation and prepare the body for sleep. Magnesium, known as the relaxing mineral, can also significantly improve sleep quality when supplemented properly. Cognitive behavioral therapy for insomnia, CBTI, has shown superior results to medications in long-term studies. Did you know that the quality of your sleep is directly linked to your risk of developing dementia in the future? Find out more below. 7. Metformin, the diabetes control that robs you of your vitamin B12. Metformin is the first-line drug for the treatment of type 2 diabetes, prescribed to millions of people. This medication is generally considered safe and effective for controlling blood glucose levels. What many doctors don't mention is that metformin can significantly reduce vitamin B12 absorption. Vitamin B12 deficiency is recognized as one of the leading causes of reversible dementia. A lack of this crucial vitamin can manifest as mental weakness, unexplained tingling, and progressive cognitive decline. Many patients with B12 deficiency are mistakenly diagnosed with dementia or depression when the problem is fully treatable. Warning signs include tingling in the extremities, persistent fatigue, and difficulty concentrating. If you take metformin, discuss with your doctor about the possibility of supplementing with vitamin B12. It is important to remember that type 2 diabetes is primarily a lifestyle-related disease. Dietary changes, such as reducing refined carbohydrates and increasing fiber intake, can naturally control blood glucose. Regular physical activity increases insulin sensitivity and may reduce or eliminate the need for medications in some cases. Natural supplements like berberine, apple cider vinegar, and Ceylon cinnamon can also help regulate blood sugar levels. What if I told you that there is yet another common drug that affects B12 absorption? Read on to find out. 8. Proton. Pump inhibitors, the digestive threat to your brain. Proton pump inhibitors such as omeprazole, pantoprazole, and lansoprazole are used by millions of people daily. These medications are prescribed to treat heartburn, gastroesophageal reflux, and peptic ulcers. Like metformin, PPIs also significantly impair the absorption of vital vitamin B12. Long-term use of these medications can lead to nutritional deficiencies with serious neurological consequences. The connection between digestive health and brain health is an emerging area of medicine that reveals how our digestive system directly influences our brain. Many patients take PPIs for years or even decades without any monitoring for nutritional deficiencies. In addition to B12, these medications can also affect the absorption of magnesium, another nutrient crucial for healthy brain function. Natural alternatives for digestive problems include dietary changes, such as avoiding trigger foods and eating smaller portions. Herbs such as ginger, chamomile, and fennel can relieve digestive symptoms without interfering with nutrient absorption. Elevating the head of the bed and avoiding eating close to bedtime can also significantly reduce nighttime reflux. Stress management techniques are particularly important, as stress can exacerbate digestive problems. Always consult a physician before discontinuing the use of PPIs, as abrupt discontinuation may cause rebound hyperacidity. But is reviewing your medications enough to protect your brain? The next topic may completely change your approach. 9. Doctor's consultation. Why reviewing your medications can save your mind. Many Americans take multiple medications prescribed by different doctors without a comprehensive review. This practice, known as polypharmacy, dramatically increases the risk of harmful drug interactions. When multiple drugs interact with each other, the risk to brain health can be much greater than that of each one alone. A thorough medication review with your doctor should happen at least annually, especially after age 60. Open communication with your doctor about cognitive concerns is key to identifying medication-related problems before they become permanent. Many patients are hesitant to question prescriptions or report side effects, fearing it will appear difficult or problematic. Remember that you are the expert on how your body and mind respond to the medications you take. Keep an up-to-date list of all your medications, including supplements and over-the-counter medicines. When consulting new doctors, make sure they know all the other medications you use. Ask specifically about the possible cognitive effects of any new medication prescribed. Consider taking a family member or friend to important appointments to help process information and ask questions. Do not discontinue any medication on your own, even after reading about its potential risks. What would be the impact of a complete overhaul of your medications on your brain health? The answer may be surprising. 10. Natural arsenal. Powerful weapons to protect your brain from dementia. Nature offers us numerous substances that can protect and even improve brain function. Unlike many medications, these natural alternatives generally have few side effects when used correctly. The omega-3s found in fatty fish have consistently demonstrated benefits for brain health in scientific studies. Turmeric combined with piperine has potent anti-inflammatory and antioxidant properties that protect neurons. The revolution in understanding the gut microbiome has revealed that digestive health is critical to protecting the brain from inflammation and degeneration. Fermented foods like yogurt, kefir, and sauerkraut feed beneficial bacteria that produce neuroprotective compounds. Antioxidants found in red and purple fruits fight oxidative stress, one of the main factors in the development of dementia. Vitamin D, often deficient in the American population, is crucial for brain health and cognition. Regular physical exercise increases cerebral blood flow and stimulates the production of brain-derived neurotrophic factor, BDNF. BDNF works as a fertilizer for the brain, promoting the growth of new neural connections. Quality sleep is perhaps the most powerful brain protector, allowing for the cleansing of toxins and the consolidation of memories. Social engagement and continuous mental stimulation create cognitive reserve, which can delay the onset of dementia symptoms. But are you ready to take the next step and really protect your brain for decades to come? Decisions that transform your path to a healthy brain. Now that you know the medications that can compromise your brain health, it's up to you to take protective actions. Knowledge without action is like a seed that is never planted. It has potential, but it will never bear fruit. Get started today by making an appointment with your doctor to review all of your current medications. Take this text with you and discuss alternatives to any risky medications you are taking. Your brain health isn't something you should leave to chance or simply wait for busy doctors to prioritize for you. Invest in your brain health as you would invest in any other valuable aspect of your life. Gradually adopt the natural alternatives mentioned by introducing them one by one into your daily routine. Remember that prevention is infinitely more effective than trying to reverse cognitive damage after it has started. Share this knowledge with your loved ones, especially those who take multiple medications. The information you've just acquired can literally save memories, preserve relationships, and protect identities. Imagine being able to keep your most precious memories intact, recognize the faces of your loved ones, and maintain your independence in old age. All of this is possible if you take proactive steps now to protect your brain from the harmful effects of certain medications. Your future self will thank you for the conscious decisions you make today. Your brain is the most complex and precious organ you have. Protecting it should be your top priority. And remember, every little change you make today builds a stronger, more resilient brain for tomorrow.